Most Americans at some point in their lives will have blood in their stool. If and when this happens, it's very important to consult with your doctor. Joining us this morning is Dr. VJ to tell us what makes it worse and the changes you can make to avoid the whole problem in the first place. Good morning, Doctor.
Good morning, sir.
This is a serious thing, right? This is not something you look at and say, that's something just...
That's absolutely right. While the vast majority of instances that result in this is due to hemorrhoids, there can be some pretty severe, pretty significant health issues that can result in blood in the stools. So even if you have it for short periods of time, it's definitely important that should you notice blood in the stools, you see a physician and get evaluated.
Now, I'm curious to find out, how do you avoid this thing happening?
Okay, well, the number one cause of this is hemorrhoids or fissures. And you can avoid hemorrhoidal inflammation or fissures by eating a proper diet, which is high in fiber and high in water. So long as you have a diet high in fiber and water, well, your stools are going to be soft and bulky, and you're not going to inflame the hemorrhoids or the fissures. Of course, genetics also play a part in this, but so long as you have a good diet high in fiber and water and avoid hemorrhoids and fissures, the likelihood of you getting blood in stools is less.
Supplements, fiber pills, is that something that's worth having on hand?
Absolutely, absolutely. If you cannot have a diet high in fiber, either because you cannot eat fruits and vegetables or you will not eat fruits and vegetables, then the next option, which isn't as good, but it's certainly a good option, is to supplement your diet with fibers and make sure you stay well hydrated.
Now, you said it's important to tell your doctor about any problem you're having.
That's right.
How soon do you need to tell your doctor if you notice this?
It is not an emergency, but you call and make an appointment. And once you do, your doctor will evaluate it. Most likely, as I mentioned, it's due to hemorrhoids or fissures. But you do need a colonoscopy every 10 years or so to make sure that it's not due to something much worse, such as a colon cancer or a rectal cancer. Absolutely.
And this is something like with hemorrhoids can be treated topically as well as surgically. I know that.
That's right.
My father went through that.
That's exactly right. The vast majority of the time, adjusting your diet, increasing the fiber and water, and using topical creams will help the hemorrhoid shrink enough where it stops bothering you. If that doesn't work, then the next option is surgery. And in surgery, they usually either remove the hemorrhoids or tuck the hemorrhoids up.
It's kind of like removing a vein, right? I mean, that's what it amounts to.
Hemorrhoids are vascular tissue. That's exactly right. They are, in essence, a big blood vessel around your anus that can be removed if it has to be done.
Tough topic, but good to bring up because people don't talk about this kind of thing.
That's exactly right.
Dr. VJ, good to see you. Thank you so much for stopping by.
My pleasure. Thank you very much.
And if you have a question for the doctor, all you have to do is send us an email. This is the address, news@KIIITV.com, or post it to our Facebook wall. The doctor is in